Hello and welcome to Where Health Happens. I'm Mike Morland. On college campuses across the country, future health professionals are learning the science of medicine in classrooms and clinics. But some of the most meaningful lessons happen where the learning meets service. At the Eugene Applebaum College of Pharmacy and Health Sciences, preparing the next generation of clinicians means understanding communities, addressing barriers to care, and seeing how health systems work behind the walls of a hospital or clinic. That perspective often comes from experience outside the traditional classroom, and in some cases, very far outside. Today's guest is Colin Colter, Assistant Clinical Professor in Wayne State's Physician Assistant Program. Throughout his career, Colin has worked in community health settings across the country, focusing on expanding access to care for underserved populations. Recently, he's taken that commitment to service into the global health space through his work with Exxat Cares, an initiative focused on expanding healthcare access and supporting community-based efforts around the world. In today's conversation, we'll talk about what global health outreach actually looks like, what students learn from these experiences, and how lessons gained abroad often mirror the challenges we're seeing right here at home. So with that, Colin, welcome and thank you for being here.
Thanks for having me. I am really happy to be here.
All right, so just before we jumped on here, I had a chance to get to know you just a little bit better, but go ahead and tell our audience a little bit about yourself, how you ended up in this field, and kind of what drove you to this point.
Yeah, so I came to Wayne State for undergrad back in 2012. And I knew that I wanted to go into like the health professions. I had thought about going to med school at that time. My mom got sick with breast cancer when I was younger, and she kind of went in and out of remission. And she had a really great medical team that not only treated my mom like the patient, but also recognized that it was a really scary process for the kids involved too. So throughout my time at Wayne State, I found out what a physician assistant was and decided to kind of direct my attention towards that. So after graduation, I took a gap year and was working in Wyoming at a camp for kids with learning differences and ADHD. I was able to build up some clinical care hours there and then returned in 2017 for the PA program. It was a lot, but it was also great. I met my partner there. I met some lifelong friends. I then graduated in 2019 and began working in a primary care setting that also did HIV management, sexual health, and gender affirming care. And one day out of the week, I got to practice at Community Health Awareness Group, which was like the sister nonprofit downtown. 2019 was an interesting time to start a career in medicine.
Definitely.
And so learning how to be a PA, learning how to specialize in HIV, and also just like learning how to be a person during a global pandemic. We stayed in this area for about 3 years and then started taking travel contracts through locums tenens.
Okay.
So we worked with a pretty similar population in Phoenix at a federally qualified health center. We worked in Northern California at a rural health designated primary care. We worked on like the Oregon coast in another rural health, federally qualified health center setting. I also did some like school-based clinic there. And then for the last year, I had been working at a FQHC in San Diego, working with a predominantly unhoused population. So yeah, when I was a student here, I did think that in some capacity I'd be interested in coming back in more of like a educator role.
Okay.
So I just started being the clinical coordinator for the PA program in September, and it's been going really well so far.
So what you're telling me is you have not been busy the last 10 years of your life.
Feet have been kicked up and very relaxed.
Yeah. So one thing I want to go back to, because I find this interesting and I'd love to hear your perspective. So you mentioned that you started your career kind of right on the heels of the pandemic. What was that like for you coming from being a student and kind of just being thrust right into all of that? I would imagine, I mean, for seasoned professionals, it was a lot. What was that like for you, and what do you feel like you've been able to take away from that you can use in future work?
Yeah, so it was a lot. I think like so much of medicine is grounded in like evidence-based recommendations. And it's really hard to make evidence-based recommendations when like the thing is just happening right
Right.
now. So there's a lot of trying to do like risk modification, kind of leaning on similar situations and trying to form best practices. But ultimately, like patients were just really scared. They were trying to do the right thing. They wanted to take care of themselves. They wanted to take care of loved ones in their community. So I think honestly, like the biggest thing was just learning how to talk to people in kind of
Hmm.
vulnerable settings. And yeah, I was really fortunate to be at a practice with, it was just like a great learning environment with the physician, the
Hmm.
PAs, and the NP that worked there. And they were really supportive in kind of taking me on and teaching me how to do regular medicine and
Right.
also in a very evolving space.
So how do you feel then at this point? Or were there any things from that that kind of changed the way you felt about medicine and the role that physician assistants, for example, play in that larger healthcare role?
Yeah, I think like maybe more so than the pandemic, but like the practice that I was at,
Mhm.
uh, the like management of HIV, I think really informed my like decision making and like ideas around medicine itself.
Mhm.
I think generally speaking, there's still a lot of stigma associated with the disease. There's still many people that think of HIV as like a death sentence, and that
Mhm.
is just like not at all the case.
Right.
Many patients are taking one pill once a day
Mhm.
without side effects, and over the last 15 years or so, U equals U is like a major campaign. Undetectable equals untransmissible.
Mhm.
So as long as a patient is controlling their HIV
Mhm.
status with medication, their viral load remains undetectable for
Mhm.
6 months. It's actually impossible for them to transmit the virus to someone else, even if they had unprotected sex, even if they used injection substances
Mhm.
and shared a needle with someone. So I think that education component of
Mhm.
healthcare, providing like a compassionate space, really kind of determined the trajectory that some of my next couple of jobs have been.
Right. And so let's talk about one of those roles. So right now you've been working with Wayne State University since the fall
Mhm.
of 2020 or 2025. And you recently, and what kind of raised your name on my list of people to talk to is some time you spent in India. Talk a little bit about the organization you work with there and your time there.
Yeah, so Exact is like a medical student education learning platform. So there's a lot of different modalities that they utilize, but we predominantly use it as a platform for students to send their profile to preceptors that will be facilitating their learning during the clinical year. Students are able to log patient encounters that they have, HIPAA protected. They're able to log the hours that they're working at each clinic. And then also preceptors are able to complete like a evaluation at the end of the rotation,
Mhm.
so that we're able to continue to make sure that students are meeting the learning objectives. And students are also able to evaluate the preceptor insight so
Mhm.
that we can make sure that it's kind of a mutually beneficial relationship. So back within a couple weeks of starting here, my coworker had forwarded an email to me and the program director
Mhm.
about this global health initiative that Exxat does called Exxat Cares. And my program director responded, "Awesome, looks cool." And I was like, well, that feels kind of like an endorsement to apply.
Yeah. Like,
Uh,
why not? I'll do it.
yeah, so I sent in an application talking about some of my, like after graduation, I did a 2 year certificate with the medical school called GLUE, which
Okay.
is the Global Local Urban Health Equity Program. And I think that really informed also a lot of my grounding in like global health practices and
Okay.
principles. So I got accepted to go on this trip, and the program was really supportive of that. So it took place in Pune, which is about 4 hours outside of Mumbai.
Okay.
So there were, I think, 3 virtual information sessions before leaving. I got to meet some of the other educators at JFK Airport
Okay.
on our layover. And then we took like a 13-hour flight to Mumbai. There we got into a van and drove about 4 hours to Pune.
Real quick, had you ever been to India before?
No.
So you just kind of you hop on a plane, you get there and get ready to practice medicine in this completely new place you've never been to. And so before you continue, how was that feeling of getting oriented as you kind of got off? Did you have this moment of thinking, what did I get myself into, or were you kind of nervous and excited?
I would say mostly excited.
Okay.
I think like something that was pretty appealing of the trip is like the information that was provided about Exxat Cares. They were pretty grounded in like I would say standard global health principles in terms of like this wasn't we're gonna get a bunch of American medical providers and like fix a problem somewhere else that maybe
Mhm.
although well intentioned,
Right.
maybe there's not the greatest understanding or
Hmm.
sustainability to that approach. So it was very much more about like bidirectional learning.
Hmm.
We got to Pune and then drove almost another hour to this very rural region that
Mm.
the hospital and orphanage that we were staying at
Okay.
was located, called Aplagar. And this is a free hospital that services kind of local, they described it as like tribal communities.
Okay.
And so oftentimes patients are arriving on foot or sometimes by like moped.
Right.
And the services were so robust. Since getting back to Michigan, have been working with Fern Care, which is a
Hmm.
free clinic in Ferndale,
Okay.
and then the Gary Bernstein Clinic, which is a free clinic in Pontiac.
Okay.
And both of those clinics are amazing in terms of the services that they can provide for patients. But it is primary care.
Right.
With Gary Bernstein, there's some specialists involved,
Hmm.
but it's not a hospital.
Right.
And I don't know if you know, but American healthcare cost
Yes.
can be dramatic. And I think just to see the infrastructure built
Hmm.
in a way that patients were able to get surgery.
Right.
They were able to see eye specialists. They were able to bring their kids to a pediatrician.
Hmm.
They were able to receive immunizations and get their mammogram done for free. Those kind of wraparound services were just really, really incredible to see in
Hmm.
practice.
So, you talk a little bit about the difference between US healthcare and India's healthcare. In regards to the quality of care, as well as just looking at the population of India, specifically in the area where you were, is there any challenges that that region is facing that is similar, or there's parallels to what we're facing in, let's say, the Metro Detroit area?
Yeah, I think definitely. There are, I would say, just about everywhere in the world, there is a lack of access to quality medical care.
Right.
And how that manifests can look differently.
Right.
In Detroit, like our backyard is the DMC.
Yeah.
We have the Henry Ford Health
Yeah.
System, which is
Children's
great.
Hospital. Yep.
Yeah. However, cost can be a huge barrier
Right.
that drives people to be hesitant to seek care until
Right.
there's really not an alternative.
Hmm.
And I think like even before you get to that step,
Hmm.
which really again is present everywhere,
Hmm.
is the like social determinants of health which influence health
Right.
outcomes. So you could be the most compliant person with your medication,
Right.
quote unquote compliant, but if you don't have access to like stable food, how is your diabetes going to be managed
Right.
appropriately? It just, I think many people globally, but also in healthcare, I think sometimes can lose track of like how much you take for granted.
Yeah.
Like it is jarring to not know like where you're going to get water from,
Right.
like the thing that you are
Yeah.
75% of.
Right.
When people don't have stable housing, like it's really hard to focus on those next steps.
Right.
So I think that is something that my patients here in Detroit, as well as some of the patients that I was working alongside some of the providers there in India, were experiencing as well.
So, what would you say are misconceptions that people here at home might have about international health and access to care? I know you kind of touched a little bit on that, but I think often many people learn about things from outside their realm, things they see on TV, things they read. How much of that would you say is relative and accurate to the reality of kind of international health, not just in the work that you did in your time in India, but other parts of the world as well?
Yeah, I think like two of the like biggest pillars for global health involve like authentic relationships.
Hmm.
So with this Exxat Cares trip, this was the third iteration of it over the last like decade.
Okay.
But even before the Exxat Cares trips started going to this
Yeah.
hospital, the founder of Exxat had established a relationship with Kaka, which means like paternal uncle, which is
Okay.
what the guy who created the
Okay.
hospital and orphanage prefers to go by.
Okay.
So I think like that felt pretty good about engaging in this relationship.
Hmm.
That there's some element of like a through line and not just hey, we are projecting a need into this community, so we're going to come in regardless of what the community believes are their own needs or
Right.
resources. And I think like sustainability is a really important thing as
Right.
well. So this hospital is operating independent of Exxat Cares, of American providers.
Okay.
We were not there to like fix a problem, quote
Right.
unquote. We were there to learn to see
Yeah.
what an incredible capacity they have already built for
Hmm.
themselves and to try to take that back to our communities.
Yeah.
Like it really was just so impressive,
Yeah.
the state of the hospital and the care that they were providing.
And that actually leads me into my next question is what are the outcomes that physician assistants and students gain from doing this program and having an opportunity to go overseas? And you were there for how many weeks?
So I was actually just there for like a week and a
Oh, a
half.
week and a half. Okay.
Yep.
And so, yeah, what's kind of that goal of spending the time there, of the takeaways that you can bring back here, as well as obviously the work and the service you're giving to that community?
Yeah, I think like it is really important to understand the systemic elements present in healthcare. I think when I was a student, or at least like in the beginning of being a student, I thought very much that like practice would look like a patient comes into the
Mm,
exam room, we diagnose the problem, we come up
mhm.
with a plan together, they take the medication or make the diet change, and then like the problem is resolved.
Right.
And so often that is not the reality
Right.
for all of these much more, I would say, systemic issues. And I think it is really important in a clinician's education to see that maybe the face of the issue is
Hmm.
different, but like the larger problem
Yeah.
is the same thing that's affecting your community at home. And like, what novel ways has this community tried coming at the problem?
Hmm.
What are some of the other contributing factors that this community experiences? So it really is a learning both ways
Right.
and not just going in with, say, an agenda.
Right. So now that you're back, what do you hope that that experience you'll be able to take to the communities that you work with, both at Applebaum as well as the Detroit communities, and teach? What are some of the things I guess you hope that may have opened your eyes up in just that short time you were there that you think that we could be doing a better job back at home?
Yeah, I think so. With the PA program, we are in the process of developing an international rotation,
Okay.
which would be an elective called Elective Africa.
Hmm.
The rotation that we are implementing takes place in Mombasa, Kenya.
Hmm.
So one of the largest regional hospitals in the country. Students will have the opportunity to rotate through different specialties there. So I think kind of mirroring your last question, just
Yeah.
that kind of on the grounds experiential learning component.
Hmm.
But I think again, with the glue program that I had done with the medical
Right.
school, you can do global health in your community, in your
Right.
local area. So it is, you can learn about social determinants of health in a
Hmm.
textbook and understand that that is sad or hard or impacts care,
Right.
whatever kind of variable that it resonates with you. But I think it is different in terms of your viewpoint or consciousness shaping to experience that firsthand,
Hmm.
especially if you have lived a life where you haven't been challenged in one of those
Right.
capacities. So, really trying to engage our students from that standpoint. But also, I think from a patient care standpoint, recognizing what resources
Hmm.
are available for student or for
Right.
patients and doing your best to link them. Like you don't have to reinvent the wheel.
Right.
There's a ton of great organizations in Detroit through the city, as well as non-governmental
Hmm.
organizations that are trying hard to
Hmm.
address some of these problems.
Right.
Detroit, the new mayor, Sheffield,
Yeah.
she just signed into action RX Kids, which is a program
Right.
that was originally based in Flint
Hmm.
with Dr. Mona Hanna, who wrote an incredible book that I recommend to everyone, What the Eyes Don't See.
Hmm.
And she's the pediatrician that helped to uncover like the Flint water crisis. Dr. Mona had recognized a need in the community with her patients that she was seeing every day for financial instability in expectant mothers.
Hmm.
So she created this program that essentially it's cash in hand.
Hmm.
So $1,500 prior to delivery, and then $500 each month for 6 months after
Okay.
delivery. And the findings were significant. You would assume that like expectant mothers gaining resources is a good thing,
Yeah.
but in terms of reductions in preterm birth, it was almost 20% reduced in
Hmm.
Flint. In terms of reduction of like low birth weight, that was reduced by almost 30%.
Right.
Reduction in maternal mental health concerns was down by about 10%. A reduction in evictions for expectant mothers.
Hmm.
So just trying to leverage things that are already being done by other motivated people,
Yeah. Right.
and linking patients to resources that they feel that they need.
So, one of the things that I find interesting about your work is the fact that you have the experience working in clinics where people may not have the funds and the resources to pay if they would have insurance, for example. And that's a very big, broad topic, and I could sit here all day and talk to you about patient care and the cost of care and things like that. And I think for people who have been fortunate enough to have insurance their entire lives and never have had that need to go to a free clinic. There can, I think, be misconceptions of what they are and the quality of care that you get. I was hoping that maybe could speak firsthand, just kind of what that experience is like in there for for those people, especially the quality of care they get, as well as I think the challenges that physicians and physician assistants may face in already a underserved and struggling population that comes into clinics like that, and how the roles that you play in that, not only for the care, but just kind of that betterment of their lives.
Yeah, I think some of like the stigma that you're talking about with like free clinics, I
Hmm.
think even expands to like community clinics
Hmm.
where patients with Medicaid or maybe are underinsured
Right.
utilize. And having worked at several across the
Hmm.
country, I can say that the quality of care is great. Like I would go to any of the providers that I worked alongside
Okay.
to have my own care done.
Right.
I think to operate in like a free clinic, there are maybe some limitations in terms of like, say that you need to be referred to a specialist or you
Hmm.
need some kind of advanced imaging. There, like Basha is a imaging center that does reduced cost imaging,
Okay.
but there can still be a cost associated with
Right.
that. At the Gary Bernstein Clinic in
Hmm.
Pontiac, they have some agreements with the hospital system
Hmm.
across the street, so that some imaging is able to be done for free. They have done a really good job of recruiting specialists to
Hmm.
practice, whether that's one day out of the week, similar to the way that the pediatrician and the gynecologist
Hmm.
operated at the hospital in India, where they're able to loop in that specialty care
Hmm.
still at no cost for patients. I think there are many providers that recognize that like the American healthcare system is not perfect and that there are many things that they'd like to change,
Right.
and it can feel really overwhelming in
Right.
terms of being an individual in a huge system
Right.
and not knowing how to engage in a way
Hmm.
that's meaningful. And I think that like finding a way to engage in any
Hmm.
capacity is is how change happens.
Mm-hmm.
So I think for providers that are interested in spending a day or a half day
Right.
out of the week or even out of the month to give services that they have specialized in and
Mm-hmm.
developed is a really good way to meet need. And I think that yeah, you can just find that it is really fulfilling.
So we're nearing the end of this episode, and I know there's a lot of heavy topics to talk about in health, but one of the things I often try to end these on is what is encouraging you about health right now? What's something in the scope of what you're seeing? And you were just talking about kind of being that small fish kind of in the ocean, not even a pond. Like it's gigantic. And
Yeah.
so what do you see that encourages you about health in the future, both within the Metro Detroit area, but just at kind of that larger world scale?
Yeah, I think that, I mean, recognizing a problem is the first step, and it is really easy to feel discouraged at the
Hmm.
scope of the problem and
Right.
how it feels like it bleeds into so many different social issues
Hmm.
like housing, like food, like
Hmm.
water shutoffs. So I think feeling a little despair is okay.
Right.
But I think the more important thing is to feel the hope,
Hmm.
and most important thing is to like make that hope actionable.
Right.
So doing something.
Right.
And it feels really good to me, I would say,
Hmm.
to see the other providers at these practices
Right.
caring, to see the other providers across the country going to learn from an infrastructure that has been
Right.
set up in a different country,
Hmm.
to see the mayor of Detroit implementing evidence-based changes
Hmm.
for the people that are her constituents.
Hmm.
I think it is really easy to feel siloed in your desire to make change,
Right.
and that's just not true.
Hmm.
So it's tapping into the resources that are present and doing something about it.
Yeah. You know, I think one of the things that's unique about the health industry that is different than so many others is how it impacts everybody. Because, for example, you can have a computer, but you don't really get a sense of how it's made. You live in a house, but you didn't help build it. But with healthcare, I feel like it's different because you are, whether you're working in it or you're from the patient side, you've been through the system, you see how the insurance process works or doesn't work.
Mhm.
You see the different types of care you can get depending where you are locally, regionally. So I guess my question is for the average person, what can they do to try to better the system that they are within, whether they're a patient or they have a family member who has been ill or needs help? What can the I guess average person do who's not necessarily in the system but can help maybe influence the system?
Yeah. So, I mean, from the individual standpoint, I would say kind of two things like control the things that you can control.
Hmm.
So, like physical activity is super important. So,
Yeah.
whether that's just going for a walk every day, like
Hmm.
that's a huge impact.
Yeah.
Recognizing the challenges associated with
Hmm.
substances, whether that's tobacco, alcohol, or something
Hmm.
else, trying to like harm reduce and recognize what is what role does this substance play in your life
Hmm.
and what resources are available to
Right.
curb that. I think advocating for yourself is really important, and there can be a lot of shame associated with whether it is substance use,
Hmm.
whether it's food instability,
Hmm.
housing
Hmm.
instability, because there are many clinics that have resources that hopefully patients are being screened for.
Right.
But again, it's that linkage of the resources that exist to the people that need
Right.
them. Sometimes that chasm can be pretty
Hmm.
big. So yeah, advocating for what your needs actually are, because that plays such a significant role in your health and just the quality of your life overall. But I think also it is for people that are working in some of these areas that feel divorced from healthcare,
Hmm.
trying to think of ways that you could tag in a local clinic,
Okay.
whether that's like a wellness fair in the backyard,
Hmm.
whether that's offering reduced fees to the services that your organization
Hmm.
provides. I think community plays such an important role in health outcomes. And I think that expanding that border of who you consider your community is never going to be harmful.
We're kind of at time, but before we wrap up, is there anything that you wanted to touch on that we haven't touched on already? Or any closing thoughts then?
Yeah, it feel really privileged to work in healthcare. I am really grateful that some of these organizations exist. I'm really grateful to the students that we have that are interested in becoming healthcare providers. And I think that, yeah, just caring, no matter what you do, can go a long way. So.
All right. Well, thank you. I appreciate you joining me and wish you the best of luck in everything ahead.
Thank you very much. Thanks for having me.
And that'll do it for this episode of Where Health Happens. Thanks again for joining me. I'm Mike Morland. If you haven't had a chance to check out some of our earlier episodes, I highly recommend going back and checking those out. We recently spoke with Christine Kivlin, who leads the Stella Lab. You may have seen some of her work recently featured on local media, as well as a great episode we recorded with Christine Rabinak, who's the Associate Dean for Research at the Applebaum College. They both had great stories, great perspectives. I highly recommend going back and checking out their work. So until next time, take care and stay well.